Ravi, we are not here to tell stories. We are here to treat people. Yes, but treatment happens with communication, communication to the patients, right? How can you make that communication more effective so that you have better treatment outcomes, healthier patients, is what this short session is about. But in fact, I differentiate between storytelling and storytelling techniques, right? So we will introduce 4 techniques of storytelling. And at the end of the day, it's just clearer communication, right? Storytelling sometimes can be a fancy word, but essentially it's clearer communication. Analogies can be great in understanding, explaining complex or technical ideas, right? So many of you might have heard of CRISPR, which is used for gene editing. And does anybody know what is the analogy that people use for CRISPR? You want to continue to play with your grandkids? Please take a BP medication to keep your health in control, right? So you'll have to see what does that person care about.
Hello, thank you for tuning in. If you want to come back to this video later, just tap on the like button. It will save it to your like videos so it's easier to find. And don't forget to hit on the bell icon to get notified whenever we drop new content. Stay curious, keep learning, and see you on the inside.
Hi, good evening, dear friends. We are pretty excited to start off a new series of conversations tonight under the label of Practice 360. And the idea here was to touch upon topics which are crucial to clinical practice, but non-clinical. So most nights of the year, we look at diabetes, cardiology, oncology, and new drugs, new treatment protocols, and so on. And we thought it would be an interesting idea to also touch upon the subtler aspects of the art of practice. As this series goes along, we'll be covering like a fair bit of topics in this bracket, but we would love to hear from you. What are the topics which you would like to hear in this practice 360, like practice from a 360-degree lens? So please do put in your thoughts and ideas in comments, and we'll definitely try to cover them as this series pans out. But when I started this, I forgot to introduce myself. Uh, my name is Rohan Desai, and this is interesting because I was just reading a statistic before coming on stage, and it said that 80% of the doctors forget to introduce themselves when a consultation starts. So this is this is how it is, right? We assume that because they've come to the chamber, they know us, but a little bit of like warm up, ice breaking goes a long way. And by the same paper, this was a published paper. So by the same paper, 50% of the time we also do not consistently address the patient by their name, and just invoking the name goes a long way in building trust and confidence. So yeah, it was things like this. I think communication and handling critical situations, storytelling, these were never part of our MBBS curriculum, and these are just things we are supposed to know, and they were not part of the school curriculum either. So we thought it would be interesting to hear from an expert in professional communication. I'm very happy to introduce Ravishankar Iyer. He is a very good friend of mine. He happens to be my first boss, and I started my consulting career under the guidance of Ravi, under his mentorship back in 2009. And yeah, so have had the privilege of knowing him for a really long time. As you'll see, he's one of the most like structured and deep thinking person on any subject. He'll talk about his journey once he starts his presentation, but uh, he's a chartered accountant turned management professional. He did his MBA from IIM Ahmedabad in 2005 and spent years in consulting and then in the skill vocational uh, training sector, and then slowly found his way into his calling, which is storytelling. So he's a professional coach, and uh, he does corporate trainings, and he's also recently published a book which a book on storytelling, which he'll probably talk more about. So yeah, with that quick, I was chatting with Ravi about whether it makes sense to have a session like this from him for doctors, and he thought it was a very interesting idea. So he's been kind enough to distill a lot of his learnings and contextualize it to the practice of medicine, and put this session up for us. So I really hope that everyone will uh, enjoy. This is a MBA/CA take on the art of storytelling, and you'll see frameworks and you'll see examples, and I hope that you would be able to take some of them and use them in your practice. Thank you so much for joining in tonight. Really appreciate your presence. And with that, I'll hand over to Ravi. Welcome, Ravi.
Thank you so much, Rohan. Absolute pleasure doing this. I was just thinking about this, right? Everybody, ladies and gentlemen, doctors, that I've been doing this for 9.5 years now, and I have worked with like large clients. I'll share some of the names. About 9,000 people I must have trained, mostly mid to senior level leaders. But today I'm feeling nervous because I'm talking to a very different audience. So I don't know how it will go, but I'm also very excited. This is a community that like everybody's heart goes out to. It's you guys work so hard. You take care of everybody, the entire society. So this is my small input in terms of how, while you are excellent from a clinical point of view, how you can also make small tweaks and improvements in the communication to not just become a better doctor, but at the end of the day, to get better patient outcomes. So I'm very excited to share some ideas. So yeah, I am happy to start. Ron, would you like to set any other context or share anything else about Medflix before we start?
No, Ravi. We're good to start.
Okay,
Yeah,
perfect.
you can share your screen and
Let me do that. So, see, I'm an old consultant, ladies and gentlemen. So, old habits die hard. So, we don't do anything without a presentation. So, here we go. Let me share my screen and I just confirm
some
with
bullet points and some.
as always. Let me know once my screen is visible.
Yeah, it's visible.
Okay, perfect. Good evening, everyone. Yeah, storytelling. No, Ravi, we are not here to tell stories. We are here to treat people. Yes, but treatment happens with communication, communication to the patients, right? How can you make that communication more effective so that you have better treatment outcomes, healthier patients? Is what this short session is about. But before I come to
Just
that,
that,
my
just that
turn.
this is called storytelling and not telling stories, Ravi.
That's true. And in fact, I differentiate between storytelling and storytelling techniques, right? So we will introduce four techniques of storytelling. And at the end of the day, it's just clearer communication, right? The storytelling sometimes can be a fancy word, but essentially it's clearer communication. But how did I get into this, right? And Rohan was mentioning some of this. Yes, I did start off life as a CA, which means that if you have any questions about how to file your returns, tax saving instruments, stocks, bonds, tax audit, cryptocurrency, real estate, gold, anything at all, please don't ask me because I've forgotten that a long, long time back. I qualified in 2001, worked for a year and a half with L&T in the finance team, realized it was not my cup of tea, did my MBA from IMA 2003 to 5, post with 7 years in a consulting firm, and that was very formative. Here's where I met Rohan in 2009. And in fact, I used to work a lot with the healthcare sector, so met a lot of doctors, very inspiring. And the challenge was that when we were presenting to our clients, we would just overwhelm them with data, right? And sometimes we all do that. When we have a diagnosis, when we have something to share, we overshare sometimes or leave the audience confused. And the poor patient, or in our case, the client, would be scratching their head saying, what is the point? What is the story, right? And so that's a big lesson that we learned, that you have to narrate a story from the diagnosis, from the data that you have. And life then took a few turns as I started learning more about this topic. I joined a non-profit for 3 years, tried to get people jobs, did a small startup in history storytelling, tried to make history interesting for India's monuments. It did not work, but the big lesson I learned was it doesn't matter whether you're dealing with balance sheet data, business data, social impact, history, technology, science, or even clinical diagnosis. The underlying principles of storytelling, which is clearer communication, they are all the same. And so I thought this is what I want to do for the rest of my life, to dive deeper into these techniques of storytelling and help leaders from all walks of life get better outcomes. And yeah, so that's what I've been doing for the last 9.5 years. And primarily it's been for corporate clients. So I'll just give you a glimpse of the kind of clients that I work for. These are business leaders from accounting, from HR, from technology, R&D, marketing. Every function needs to learn and improve on the skill. In fact, one of the recent work that I'm doing is with a big pharma company sales leaders, and it's interesting, right, to understand how different people tell their stories well. So this is one part. The other part of my work is R&D. Like you folks research and read, I need to research and read and write. So I have a weekly newsletter where I share good examples of storytelling every week. um, I have a podcast where I've interviewed people from different backgrounds, different experts on storytelling, and tried to learn from them. And as Rohan was kindly mentioning, there's a book now which has recently come out called Story Rules, and it distills multiple storytelling techniques into very clear, practical frameworks that anybody can pick up and use. And it's 31 short chapters. Each chapter tells you one framework, and you can basically learn from that, right? So we'll talk about four frameworks, in fact, from the book in today's session. But I must tell you that having said all of this, podcast and newsletter and book, when I have to convince my 7-year-old daughter to do something at home, none of my storytelling techniques work. If you have any ideas, please tell me, but I can try and help you with the patient, right? So anyway, coming to today's session, right, I'm going to talk to you about four ideas, four storytelling techniques. These are actually four chapters in the book. Number one, and each is connected with an objective, right? The objective for the first one is how can you communicate your diagnosis, let's say, or your point of view to typically a patient, but it could be other doctors also, in short, because none of you have a plethora of a lot of time, right? Plenty of time. You're always rushing. There are too many patients, not enough time. So how do you communicate in short? We'll talk about a technique known as bottom line upfront. Second objective, how do you share not so good news, right? Sometimes diagnosis is not very good. So we'll talk about how you can do that with a small framework. Number three, how do you explain technical information in a way that the audience, the patient, a layperson patient can understand? So we'll talk about analogies. And there's a small technique I'm going to share about ChatGPT. And finally, how do you encourage your patients to comply better with the treatment plan, right? If they have to take a medicine every day, every week, every fortnight, they should not forget to do it, right? And so you have to make them realize that don't just do it because I'm telling you, do it because this is in your benefit, right? So I'll talk to you about something known as the Wi-Fi, what's in it for you, right? So these are four techniques. As I mentioned, there are four chapters in the book, but we'll take one by one. So we'll start with the first one with a small example. And here the way I operate, ladies and gentlemen, is that I'm going to ask you questions throughout. And if I ask you a question, feel free to write in the chat so that we can quickly read. And Rohan, I might take your help to go through some of the responses. So now this
Just
is a small, yeah.
if you're expecting some comments, Ravi, then you'll have to give about 10 seconds for some comments to hit, because it takes time to just type it in. And so, I mean, if you've asked a question, then just give it 10 seconds.
No worries. 10 seconds is perfectly doable. Right.
Yeah.
So, my first question to all of you is I want you to read this paragraph. It's got some data about some study that was conducted. And tell me what is the summary of this paragraph. Yeah, I have to write that in the chat.
You can pinch to zoom. No, actually, this is screen sharing, right, Ravi? Yeah. Okay.
Yeah. Or would some people be seeing it on a phone?
Yeah. Many people would be on the phone. So the question is, what is the summary of this paragraph? I'm getting lost in the first sentence.
And basic question, Rohan, can they also unmute and speak, or it's only comments?
They can't unmute. There's a feature to raise hands, but we, we generally
Yeah,
don't
okay.
like.
So we got a lot of responses. Always give positive feedback, says Dr. Mani. Be positive, says Dr. Sandeep. You're right. That's pretty much what it says. Always remember that feedback matters and try to earn more positive feedback, says Dr. Aditya Desai. Thank you, sir. Chirag says positive reinforcement motivates while negative reinforcement does the opposite. Perfect. Simple, praise the strength and give constructive feedback. Super, Parvati. Right, so all of you are right. Now, can somebody look at this paragraph and tell me, does this summary already come somewhere in the paragraph? Last sentence, Dr. Mahadev. Yes, that's true. It is the last sentence, right? Now, this is how we've been taught to write from school, that put down your findings, then say, point, I found X and Y and Z, and therefore my conclusion is praise is more productive than negative feedback. Right? That's what we've been taught to write. Now, that works in a time and age when there is no constraint on time, your audience is always waiting for you. But if you are a little time constrained and the audience is impatient and low attention spans and hooked onto Instagram reels and YouTube shorts, you may want to pull up that conclusion, right? So the conclusion can also be called the bottom line because it literally comes at the bottom of the paragraph, and take it to the top. So the framework that we call is BLUF, or bottom line up front. That's the full form of BLUF. It's actually a term that originated not in the world of business, interestingly. It originated in the world of the military, US military, right? In fact, they have a communication manual in which they have laid it out that you have to speak in bluff terms. And the idea was that you may be a junior army person and going into a meeting room with very senior generals, and time is of the essence, right? You can't make them wait for a long time saying, oh, there's a column of enemy tanks coming in, and according to our calculations they are traveling at 10 kilometer an hour and they could be going through the forest, but no, they might take the shortcut, and we think that they might be reaching our forward post by about, till that time, gone, your forward post is gone. Right? So they said, start with saying we need to send reinforcements right now to forward post because tanks are coming. So the encouragement was lead with the main news. And there are some exceptions to this. I will cover those exceptions. But majority of the time, if the news is not something that is going to shock your audience and they are short on time or you are short on time, then lead with the main news, right? So here the main news is praise is more productive than negative feedback. Now, okay, praise is more productive. For whom? We can't just leave it at that. We need to realize it's for students, and students for the math skills, for their creative skills, no, for their writing skills, right? So I will include those two in my statement, in my bluff statement, saying that praise, not criticism, helps students improve their writing. So that's my one sentence, bottom line upfront summary of my content, right? So notice that after that also I have divided into two paragraphs. Each of them has like a mini bluff there. And so the point of this activity is that, especially when there is no shock value in the, people are not going to get offended and time is a constraint, then don't go through a long-winded story saying this is what I want to say. Try and save the time of your audience as well as yourself by stating the core point that you have, like a summarized version of the core point at the top itself, right? It's a very powerful time saver. More than anything, it actually forces you to think about what this line would be. If you notice that we didn't just take this line, right? We actually added students, we added writing. So in the act of crafting that line, your summary becomes sharper, right? And by the way, AI can do the summarization really well, but we should also build this skill. It's an important skill to be built. Yeah, so bluff is important, except for the, as I mentioned, some exceptions when it's like very, very harsh news, and it applies even in a kind of a medical scenario. So I used ChatGPT, I'll be honest, to derive some scenarios where one scenario is where you go long-winded and it's no clarity, and one scenario is where it is actually clearer. And you tell me what works better, right? So here is the long-winded one. Imagine a doctor kind of, or somebody telling the patient, well, your fasting score came back as 150, and the lab uses a different analysis than the one we used last year. And there's this concept of average glucose versus fasting, and sometimes stress or steroids raise numbers. And we could repeat the test, right, to do it, or do a different test called HbA1c, which tells us more. Or we also look at diet and exercise. By the way, do you have a family history of diabetes? By the end of this, that patient is scratching saying, boss, what is the point, what are you trying to say, right? So now I don't know, it may not even be that, like, to say that somebody has a high fasting blood sugar, it's not a death sentence, right? It's a normal condition. So this doesn't need so much context setting and so much preparation, and by the end, patient is confused and, completely lost. So here, a better way to do it, and I'm going to share that with you, is start with the bluff, saying that, hey, your fasting sugar is high, we'll do one more test to confirm and then plan the treatment, right? So that to me is a very quick summary of what is happening, right? And now notice this separation also, right? The detailed ones. Your fasting sugar is at 150, which is above the accepted threshold of 100. Look, I'm giving more details, but don't worry, it is manageable. So although I've given them slightly not so good news, I'm assuaging the patient, saying, yeah, it's good, like many others go through it, right? Next step, let's do one more test called HbA1c, which will give us a more comprehensive picture. Right? That's my second point. Third, if that is also high, we will discuss the next steps in terms of diet, exercise, medicines, etc. And so please go ahead and get it done. Right now, what is better for the patient? May I ask, is the left one better or the right one better?
While we wait for the answers, Ravi, this takes me back 15 years to
Uh,
the appraisal conversations, and I wish the bottom line came up front. We would start with, okay, Rohan, so what went well? This was very good, this was very good, and we are waiting for the but.
but you're waiting for the but, yeah. So yeah. So no, thank you for those who think that the right one. And Dr. Sarfraz is fine. Even the first one could work better for some people, right? So yeah, maybe Rohan, that was too shocking. That's why we were, softening the blow for you.
Yeah,
But
that falls in the exclusion category, I guess.
exclusion category. That's what, no. Rohan is joking. He had some great year, right? So that was a simple case of stating the key point upfront. So keep that in mind as one technique. And I'm going to look. There is one thing I must tell you, right? I'm a CA, and as CAs, one thing we learned really well is to give disclaimers. We will always give a disclaimer saying, "Huh, we have done the audit, but things could go wrong." So every technique that I'm going to tell you, I'm going to put like a universal disclaimer that use with caution, right? Because you'll have to keep the patient context, the patient personality, the diagnosis, your own, the clinic scenario. How much time do you have? Is there too much crowd, too many other people? The whole keeping things confidential and all of that, right? So I'm assuming those are like common sensing that you'll keep in mind, but other things being equal, if there is no major shocking news, then go for a better summary upfront rather than a long-winded, confusing thing, right? So I think that's the key objective. That's a key point here. Let's go to the next one, where now I'm going to talk about slightly difficult situation where you may have to give some bad news. And the bad news, I'm going to again classify into two categories, right? One is bad news, which is life-threatening. I'm actually not going into that part, like, God forbid, something like a cancer or something like, very difficult diagnosis that you have to give. Those require really nuanced, a lot of empathy, and a lot of emotional regulation. So we this is kind of outside the scope of today's session. But I'm talking about bad news, which is manageable bad news, like like we talked about sugar, or we talked about osteoarthritis, or high BP. Everybody kind of many people kind of go through those, and they can be managed, right? So even there, how do you communicate that? There's a bit of a skill. And I'm going to take you through the world of business and try and tell you how they approach doing this, right? Not always, but a lot of the time, and how we can actually use that. So I'm going to take you through a case study of a business, company, which actually is in the world of healthcare. This is a company called Johnson and Johnson. And the story goes that in Chicago in the 1980s, what was happening was that people were falling ill with bad flu symptoms, and they were actually dying. So about 7 people died in a very short period of time, right? And people did not even know what is happening to them. Later, they found out that all of them had taken this tablet called Tylenol, which still I think is sold there. It's the Crocin equivalent of the US, made by this company called J&J. And like they took a cat tablet, why should they die? So apparently, then they realized that some bad actor, some nutcase had injected cyanide into Tylenol capsules, into Tylenol caps.
Right.
So the vials, right? So people took them, they didn't know, and then they ended up all dying. So it was terrible. So now, of course, the police were doing an investigation and all of that happened. But what was the reaction of J&J? That's the interesting one, right? So um, they first figured out that hey, this is happening because of all of these, and they did a bunch of interesting things to make sure that the crisis was managed in a very, very clear way. So first of all, they said, yeah, this is bad, really bad, and they took away pretty much all the old Tylenol packages that were there with a huge loss, and they did a revised packaging, a new packaging, tamper proof one, and they explained to the patients that hey, we are doing this and it's tamper proof and nothing will happen to you. And eventually it was even now regarded as a master class in storytelling, right, where if something bad happens to you also, how do you ensure that you manage the situation in the best way possible. And even today people regard that as a great case study of crisis communication. So now we are not, thankfully, in a crisis situation, but the framework that I'm going to leave with you for communicating slightly not so good news is what I'm calling the what, why, and what next framework, right? So what means what happened. Don't beat around the bush. Don't hide it. Don't try and say, I know it's an isolated case. It's happening in a few places. It's not really a big deal. So the moment you do that, right, the audience realizes, oh, it's a big deal. They're hiding. There's something cover up, right? So they didn't do that. So they admitted the issue, openly acknowledged on national media. Then why? So in why it was difficult, actually, they didn't know, right? They found out it was some rogue actor. So even they cooperated with the authorities, offered a reward to find the killer. Unfortunately, was never found, right? So they couldn't do much on the most important thing in this framework is the what next, right? So people spend a lot of time clearly outlining the next steps, right? So the way they did that was they talked about a set of both curative steps, which is to contain the damage, and preventive steps to ensure that such a thing does not come again in the future. So here's what they did. They completely recalled all Tylenol capsules, entire US, not just in Chicago region, right? It was only in one region. They could have said, hey, this is contained. Like, we don't need to do it for the whole country, but they did for the country, and estimated cost of $100 million, right? So they took that hit. Then they reintroduced the capsules in a new tamper-proof package, explained the change to the wider audience, right? So now many of these is not relevant for us. We are not, when we are saying bad news, none of it is our fault, and we are not kind of, having to take any personal this, but the framework still remains, right? So I'm going to give you a simple example of how to apply this when you have not so good news to share to the patient, right? Let's say this is the good news, this is the bad news that you want to share, that hey, your heart is not pumping as well as it should. This is a heart failure with reduced ejection fraction. And I know this is HFrEF. I'm sorry, Rohan, I did not change it. There's a small error, spelling mistake here. This is what happens when a CA tries to use ChatGPT to try and research medical terms. Yeah. So let's say you want to
That's
talk
okay,
about
Ravi, sir. Yeah. Completely fine.
is a problem, and you want to communicate that to the patient. Now the patient obviously is going to be a little perturbed, he's going to worry, and so you have to give them an assurance saying that hey, it's fine, don't worry, this is manageable, and let me tell you why, the root cause of why this is happening and what can we do about it, right? So you talk about the root cause, saying this is possibly because of the heart attack, the long-standing high BP, and a family history. So now it just feels that, oh, now I know why this is happening. Otherwise, people say, why me, why me, why me? Sometimes there's no answer to the why me. Cancer, it's very difficult, right? But at least to the extent possible, if the person can be explained that. Most important is the what next, right? And then you might have something like saying, okay, we're going to follow this line of treatment. We'll have a beta blocker, we may have an ACE inhibitor, a dose diuretic, and here are some next steps, right? I need you to do a kidney test in a week, follow up it within 2 weeks, and the nurse will give you some information on the side effects, right? So I'm sure you follow this broadly. You are anyways doing this only, but sometimes some steps get removed. Sometimes I do see that when in my own personal experience, and this might be very limited anecdotal experience, that doctors directly go to the prescription, right? They hear everything. In your mind, you've figured out what has happened and why, but then you're directly saying, ye dawai do bar lo ho gaya, right? So it's like take this medicine twice and you're done. And the patient is thinking, acha, but what is the bimari? What is my problem? And why did it come, right? So there might be some curiosity with at least some patients, and you'll have to kind of see what kind of a patients. And so for them, it might not be a bad idea for you to say, hey, you know what, this is what is most likely. And if you're not sure, give them a hypothesis. We think this is what is most likely happening to you, and this is possibly the root cause, although we're not 100% sure. Here are some tests that we can do, and here is the line of treatment that we can follow, right? So that, more than the clarity that is there in your head, it becomes clearer in the patient's head, right? And the patient somehow gets the anxiety of saying, what is happening to me? Why? That anxiety may actually interfere with the recovery process, right? That reduces. So this is the other second framework that I wanted
One
to you.
one
Yeah.
area where I also think, Ravi, this could be uh, probably used is in the case of a complication which happens with a patient. Like you're operating on a patient and something goes wrong, and which is sort of similar to the Tylenol case, but
Parallel case,
uh,
yeah, yeah,
there's a difference, right? So in Tylenol, J&J was not responsible.
yeah.
So it's a relatively easy for them to sort of be forthright about it and sort of come clean. What do you like suggest, how, if you are a doctor and something goes wrong on table? How do you? I mean, it may be in the spectrum of expected. Like, every procedure has a certain complication rate, and let's say literature says that even in a routine common procedure like appendectomy, let's say for example 1% of the cases could lead to a certain complication. Now for you it's a statistic 1%,
Yeah, correct.
but for that 1%, it's life changing, right? It could be fatal. So how do you think this framework can be used there, or like what modification, or how do you? Sorry, I'm putting you
Yeah,
on the spot.
great
And
question. No, no, it's a great question, Ron. Yeah, it's a tough one, and I would think it can still be used, right? And a very important thing in this case is exactly what you said, that you may have to do had to do some expectation setting before the surgery, before the that sometimes can be a challenge. And I remember I'd gone undergone an arthroscopy long time back, and the doctor did not share anything before the surgery, right? And later complications came, and that was a surprise. That was a, not a good surprise. So I think, yeah, setting that expectation, even it's a 1%, 0.1%, whatever, right? So you say there is a possibility that this may happen. I know it may scare some patients away, but I think it's useful to kind of, give that warning, or that expectation setting upfront. And then now some of this, Rohan, will have to go into legal terms. There I'm not an expert, right? So how much can you share? What can you share? And because there are two types of complications, right? One which is just, sheer complication without anybody's fault, or two, when there is a negligence that happens either, by mistake, or whatever, right? Different types of negligence are there. There it's more trickier, and there I will probably refrain from commenting because there's the whole legal angle there. But
and
especially,
you think
yeah.
that doctors should also refrain from commenting and sort of uh, uh, take advice from a professional before they say anything on that matter?
I don't know, man. So this, you'll have, in fact, just today I was listening to a podcast where somebody was saying that, if you go to a lawyer, the lawyer will scare you even more. They'll say, don't say
Yeah,
anything, don't comment or anything. And I think
yeah,
that actually breaks the trust even more with the
yeah,
patient, right?
yeah.
Most patients might actually not mind it if you be honest and you be upfront with them. Hey, you know what? We were worried about that 1% complication. It has come to form. I'm sorry. What can we do? But here's what we're going to do about it. Right? Here's what we're going to try and do to fix it. So that always gives, I think, personally, I feel it gives people a sense of saying, yes, it's happened. What has happened has happened. Let's try and see if we can go ahead and make it work. Right. So if you have been upfront at the beginning and shared that, and then you share after that, the chances of the patient not being happy, I think, definitely go down.
Excellent. Yeah.
But if you
No,
take away,
thank you so much, Ravi. It's a very,
exactly.
very brilliant take on that. So I think, there's a practice of informed consent in medicine. So before a surgery, patient gives informed consent, and it means informed consent because the consent form actually is supposed to lay out some of these expected complications. What happens in practice is that we probably not always get the time to, or opportunity to talk about it. So I think what Ravi is saying is, if you do expectation setting well, I think it becomes significantly easier to manage certain unexpected outcomes.
Definitely reduces the chance of that happening. And Dr. Mahadev also agreeing with that. Yeah. So that in fact, of the four techniques that I have, this is the one that has the most challenging, application, that you'll have to do. That, in what situation will you have to be a little more careful doing it, especially if there are errors that creep in, right? So just keep that thing in mind. And but let me go to the next one, which is definitely an easier one, and this is more a fun one also. So I'm going to actually try and see if you can do it in this situation itself. Analogies can be great in understanding, explaining complex or technical ideas, right? So, many of you might have heard of CRISPR, which is used for gene editing. And does anybody know what is the analogy that people use for CRISPR?
Playing with a bead of necklace of beads, or
Yeah, that works. And removing one bead and putting some, I don't know, yeah, maybe that.
moving beads, or Jenga, playing Jenga.
Interesting, yeah, agenda is interesting. And removing one thing and then, yeah. So yeah, and now with the world of analogies, it's a bit of an art. So there is no one right answer. So you could do that. Let me also wait if there are any comments that come through. Have many of you heard of CRISPR? It's for
It's still not made its way into practice to the extent. Yeah, it's
right,
still a R&D
R&D thing. Yeah.
technology. So
So the in fact the creators of CRISPR, so there's a lady called Doudna, Jennifer Doudna. They themselves use an analogy which they call as molecular scissors, right? So it's like, you're just cutting pieces of DNA and then fixing it somewhere else, or removing, essentially fixing defects, by almost using like a scissor, right? So now it's obviously not like a scissor, but it has some similarity there, and it makes it easier for lay people to understand, right? Now that's a little more avant-garde, or new. Arterial stents have been around for decades now, so we all know what that is. Now, of course, most patients also know what is a stent, but let's say there is a not very educated patient, and they're like, what is it? You're putting something in my, body that is metal, and something foreign, and how will I work? How will I go? And so maybe you can just say, hey, nothing, yeah. You see that building standing, and how do they make the building stand? They put some steel, right? And it holds the building up. It's like a scaffold. So that's essentially what this is doing. So a stent is nothing but a scaffold, and it is holding the building of your artery up. So it might just help the patient to understand something which they may find too foreign, too new, easier, right? And so there suddenly it becomes lesser stress also for them, that it's just a scaffolding. It's just like, it's making me stand, right? I'm sure many of you do this in some way or the other, and continue to do it, and especially use. Now I'm sure many patients come to you with saying, doctor, this is what ChatGPT is telling about my diagnosis. What do you think? Right? So now you can also use ChatGPT back at them to explain something complex, right? So the small technique I'm going to give to you, and then I'll open it up for anybody who wants to try it, is use this tip, use this prompt called ELI5. It means explain like I'm five. So explain like I'm five. So it's a shortcut. Instead of saying something long, you can just say ELI5 dash stents, CRISPR, whatever you're not sure about, right? And what it does is it makes it very simple to understand for any layperson, right? So now if you're trying to explain something relatively difficult, complex to a patient, and let me give you a couple of examples, right? Let's say you want to talk about metoprolol, right? I'm sure all of you prescribe this all the time, right? So I was curious to know, what does it do? What is the function of metoprolol, right? And I'm sure if I read the scientific literature, I will go to sleep. I will not be able to understand. So here's what ChatGPT comes up with for that. Imagine your heart is a race car always revving. Metoprolol is like a gentle hand that eases off the accelerator and lowers the RPM so the engine doesn't overheat and the tires last longer. Right? So now, obviously, this is not perfect and accurate, but it gives some sense to the patient, right? So the patient now knows, I need my heart to beat a little slower and not be like a fast car always going accelerator पे हमेशा पैर रखने की जरूरत नहीं है, right? And so they get some sense. So you could use this. Another molecule that you must be using quite a bit is sitagliptin, and I tried coming up with something for that. So here's what it came up with. Here's a longer one. Sitagliptin helps your body make more insulin and reduce sugar. That's the bluff. Now let's go through the details, right? Our intestines release tiny messenger signals called incretin hormones after you eat. These signals tell your pancreas, "Hey, make more insulin." I love the personification, and also tell your liver, "Hey, stop making so much sugar." The problem: these signals get broken down very quickly by an enzyme called DPP4. It's like writing an important note, but somebody crumples it up within minutes. Yeah, lovely visual analogy. Sitagliptin blocks this villain, this DPP4 enzyme, and the result: the make insulin reduce sugar signals stick around longer, and our body makes its own insulin system more effectively. Right. So this makes it easier for a person. Imagine people who have been prescribed this, they're taking it every day or every whatever on a regular basis. They don't even know kar kya raha hai, right? What is the point of all of this? And so explanations like these can help them, right? And you can in fact even create some very common molecules that you're prescribing. You can create some standard material and keep it in your clinic or give it to the patient saying, this is what it means, right? So it's just easier for them to come to terms with what is happening to them and how this is helping. It also, my sense is, it will improve the compliance because patients like, oh, it's very important here. I need insulin and I need to reduce sugar. Oh, let me take my sitagliptin, right? So yeah, so that's the power of some of these analogies.
Yeah, I was about to say it also helps drive the point why it's important to take this every day. Uh, it,
Yeah. Mm, mm.
it's not like, it has an effect for a week or 3 days. A missed dose is a missed dose, and on that day your insulin will not come out. So
So well said. Yeah, it kind of, an analogy explains that point about saying why do you need to do that better than just saying take sitagliptin.
yeah.
Is anybody excited to share this or use this for any other concepts or any molecules that you yourself might be curious about? And the funny thing is that even 2 years back we had to generate these analogies ourselves, right? So now we've got the most powerful tool available in the world to do these for us,
Yeah.
and
Yeah.
we just, yeah, it's quite powerful. And for all of you, the good thing is you can actually check it right. People like me, if it comes as a mistake, then we don't even know whether it is right or wrong, but you are better placed, right? You can actually say, hey, ChatGPT, you're wrong, this is not the right one. So also there are different AI tools. Meta has a different tool, Gemini is there, so be careful there. Sometimes it may hallucinate, many times it hallucinates. So yeah, just do that check. Excellent. The last, no, not the last, maybe a second last idea that I want to leave with you, and then we'll have some time for Q&A, is the what's in it for you question, right? So often we focus too much on saying, do this because I told you so. And that may not work really well, right? So if you take an example from business, it's a very different example, but it'll give you a sense. So this was a product that came in 2001 called the iPod. It was before the iPhone, right? It was a music device, and it had a lot of unique features when Apple introduced it. It had a monochrome LCD screen, 5 GB 1.8-inch hard drive. The others had thicker hard drives, easy to use navigation, mechanical scroll wheel, center select button, different to the competition, 10-hour battery life. Yeah, good, very nice. So they didn't tell all of this in their advertisement, right? Does anybody remember how did Apple advertise the iPod? What was the tagline that they used? Yeah, no worries. So the tagline that they used was 1,000 songs in your pocket, right? 5 GB, who cares? 5 GB, 10 GB, right? I don't know. I'm interested in my music. How much can I carry? 1,000 songs. Oh, that's quite a bit. That's pretty much my entire library. I can carry my entire library, right, in my pocket, music library. So the difference here is that you can say that, hey, these are all the technical things of what you need to do, but here's what's in it for you. So the question that Apple is answering is Wi-Fi for the audience, right? And a similar thing can work even for you when you are getting your patients to improve compliance, right? So I'm sure all of you diagnose really well, come up with good treatment plans, tell them the exact right molecules that they need to take, but ultimately whether the patient gets well or not is dependent on whether he takes the medicine, right? Many times they don't take the medicine, or they take it wrong time, they miss a dose, and all of that, and it will be frustrating for you, right? And what can you do? You can just say, right, say, please continue to take your medicine, right, because I said so. Now, because I said so is not Wi-Fi. It's not what's in it for you. So how can you do that better? Right? So less effective way is something like, Mr. Desai, sorry, Rohan, I took your name. You have to take your BP medicines, otherwise you'll suffer later. Right? So that's one way of doing it, which is, a coercion type thing, right? Better way of doing that is something like, Mr. Desai, don't you want to continue to play with your grandkids? Please take a BP medication to keep your health in control. Right? So you'll have to see, what does that person care about? Why does that person need their BP to be in control? Why does that person need their sugar, need their heart failure rate to be in control? Because of something that they care about. So you have to find what do they care about and how that can get affected because of their not taking the medicine, right? And so connect, draw the line between the thing that you want, which is taking the medicine, and the thing that they care about, which is playing with grandchildren. Or, Mrs. Raman, don't miss your HFrEF medication. It can lead to complications. Mrs. Raman, you've been visiting the temple daily for years now. This medicine will ensure that you can continue to do it without feeling breathless. Yeah, better, the one on the right. It makes the person feel that, oh, I must do this, right? And it will let me carry on with my life with things that I care about without getting impacted, right? So this is also a powerful reframing. A lot of leaders do this whenever they're trying to explain something. They'll always say that, what's in it for you as a customer, as an employee, as a vendor, as any stakeholder, right? So keeping that in mind is also quite powerful. So that was the fourth idea. I've got a fifth idea. Maybe let me finish that and then we'll open it for Q&A. uh, this is a bonus fifth idea, that listening matters, right? And you all know this, I'm sure, but I want to share some results of a study that were conducted in the US sometime back. This is by it's published in the Journal of General Internal Medicine, and it was all about, they were recording clinical encounters, patient and doctor encounters, and then trying to see what kind of doctors get sued more. This is the US. In the US, doctors get sued a lot by patients. So what is the difference between doctors who get sued and don't get sued, right? So they tried to look at that, and there were multiple things, but there were two things that stood out for them. One, doctors who were sued more spent less time with the patient, just on an average. And this, they must have, of course, controlled for the type of patient and all of that. So more time spent with the patient resulted in better patient satisfaction. And irrespective of the outcome, the patient were less likely to sue the doctor. Similarly, engaging in active conversation, things like saying, hey, okay, tell me more. Oh, that must have been tough. Just those, tell me more, or I'm listening. Those cues makes it, that, doctors who were sued more were less likely to use those. Doctors who were sued less were more likely to use those. Now, India is thankfully not as, trigger happy in terms of the legal suing as compared to the US. But look, at the end of the day, what is happening is that patients are getting more educated, they're more aware, they're coming up reading with Google Chat GPT and all. So if you want to, especially as a young doctor growing your business, if you want to differentiate yourself, it's a good idea to try and do some of these things, right? Not just the communication part which I mentioned, but also the listening parts. So try and do those. Yeah. So just to summarize the four main ideas: when you have to communicate clearly in short, think about the bottom line up front, not at the end. When you have to explain some diagnosis which may not be very good, then you say what happened, why, and then more importantly, what next? What is the line of treatment? Explain technical terms using analogies. and remember ELI 5. You can use it ChatGPT. And finally, to encourage patients to comply better, don't say because I said so, say because you need this, because you care about X, and X is taking the medicine will help you to do X, right? So those were the four ideas. Thank you so much. Do check out the book. The book has such ideas. This is just four that I have shared with you. Many of the others are also relevant. That will be something that you can learn on an ongoing basis. And yeah, I'm open for all and any questions.
Super,
Thank you, everyone.
Ravi. Thank you so much.
Thank you.
This was very, very interesting, and like all the four techniques and the bonus one, very relatable. And I mean, I'm sure uh, they subconsciously enter our behavior, and we sort of would be using it here and there, but we could probably do it more consistently. So thanks for sharing the examples, and thanks for you know taking the effort and taking the stock. Yeah, we'll
Thank you
let
so much.
people.
Fun.
Sorry.
Thank you. It was fun for me also to do that. Yeah. Thanks.
Yeah. So one question I had, Ravi, was uh, we talk a lot. I mean, we hear a lot about reducing attention spans, and people don't listen beyond 15 seconds and 10 seconds. And so, how does the importance of communication or storytelling change in that context? Like, if people are not even listening, uh, where do my stories land?
Yeah, and it's a great question, right? And this is a big problem in the corporate world. With the doctor, it's not such a big problem because the patient is usually hanging on to the word. But not all communication by doctors is with patients, right? Many times you might be presenting at a CME. If you have 40 doctors who have come and they're eyeing the buffet counter that is getting here, right? It's not easy at that time also. So um, there are many techniques that you can use to get people's attention. You cannot wish the problem away. You can't think that, oh, I wish people would pay more attention, I wish it would. That's gone. That trainer's left the station, right? And it's only going to get worse. So there are multiple techniques, but broadly what you have to do is give them something to get their attention with a hook. So use some sort of an intro hook, and there are multiple techniques. We can go into some details there, or try and make them care, right? So the intro hook part is you're using maybe a smart question. Ask them a smart question that will be like, huh, oh, tell me more. Or you give them a surprising fact. Did you know that 45% of people who have taken this medication have experienced some side effects? Huh, really? Tell me more. So you're doing something as a surprising fact, as a curiosity inducing question, as a surprising analogy that makes the audience do whatever, I mean, leave whatever else they're doing. Huh, this is interesting, tell me more, right? So that's one way to get people's attention. And the second one is that, hey, in the next 1 hour, I'm going to tell you three techniques that you can use to radically improve the outcomes after post cataract or whatever, right? Whatever is the key thing. So you're not telling the actual answer, but you're telling them what's in it for them, Wifi, what's in it for you, if they wait and they listen, right? So one of these techniques needs to be done at the very beginning. The first 30 seconds are super important, right? Often we start with a thank you so much for all the organizers for giving me this opportunity. Today I'm here to talk about. Guaranteed, people will stop listening, right? Because you're like nothing important, right? So grab the opportunity. Thanking and all can happen later, but at the beginning itself, try and say something that either gets their attention with a surprising hook, or makes them care by saying what's in it for them.
Yeah. And there's a question here. Okay, yeah.
Yeah.
How to calm? I mean, this is a reasonably frequent situation. It might appear like a one-off, but it's reasonably frequent, and this varies by specialties also. And like there are certain specialties where this is likely to be more common, like obstetrics, cardiology, oncology. But in general, like how do you calm agitated relatives? They're obviously nervous for a reason,
Yeah.
and that nervousness can manifest as anger or
Yeah.
raised tone.
Yeah. Look, I mean, again, it's difficult, very situation dependent. Again, I don't want to go to a place where there has been negligence or there have been mistakes. That's a gray zone. So we'll leave those
Yeah.
out. We'll just talk about just bad luck, right? That the patient has had either a
Not even
complication.
that, Ravi. I mean, it's just a lot of times this also happens because of administrative issues, not even clinical. So we were kept waiting for, we were not allotted a room and things which may be out of the doctor's control also. So like this is a wide spectrum of education. So yeah, you could like cover any of it.
Look, I mean, there is no guaranteed way to always get them to calm down, right? But the principle is what I'm going to leave with you, and you have to try and go directionally in that space, right? And it may work, it may not work, right? So the principle, apart from the Wi-Fi thing that we had talked about earlier, is that can you reframe the situation to make them realize that yeah, don't complain too much, things could have been worse, right? So to take the old adage, right, I was complaining that I had no shoes till I saw a man who had no feet, right? So the relatives are agitated because they are comparing their current situation with some ideal, right? So that ideal must have been whatever in their mind, and it must have been put by somebody else. It should not have been there. There should have been some expectation setting done, and so on, right? So what you may have to then do is to reframe that norm in their mind to say that hey, it could have been much worse. There was somebody else who came, and then he had to actually wait for 4 hours because of the insurance thing. Actually, we will hopefully try and do it in 2 hours itself. So basically, there's a famous sentence, right, that happiness equals reality minus expectation. So if the reality you can't change the expectation. And ideally that expectation changing should happen before so that it's not as a surprise or a shock. But then if it could not have been done before for whatever reason, you are then trying to do that in this scenario, saying that I whatever happened in the past has happened. I'm sorry about I mean whatever. And it's not me personally. I'm sorry, but I'm sorry that the hospital did that, and sorry that you had to go through this. But let me tell you now that this is normal. That it does take time. Often that insurance companies take a much longer time, and the average waiting time in this hospital for a discharge is 8 hours, right? And so we'll try our best to do it before. So basically, you've given the worst case scenario, right? You've not even said 2 hours, 3 hours, you said 8 hours, and if they leave in 6 hours, they are possibly
A
happy,
win.
right? So this technique can have, of course, a downside, right? If you say that you only have pancreatic cancer, so it could have been much worse. Brain cancer would have been that's a horrible thing to say. But I'm saying that maybe even in a cancer, yeah, I know it's terrible, but at least we have found out in stage
We
2.
caught it early.
We caught it early, right? Stage 4 could have been like no. So every situation it could be technically
There's
worse, right?
always
And
a yeah.
you,
Yeah.
your job is very subtly kind of tell them that thank God at least this much we have in our control, right? So they are then reframing and saying okay, let's whatever, accept the situation and try and do what we can do to make it better.
Also, I guess like a part of the agitation is about just venting
Yeah.
more than really
And I think
seeking
it's not the
answers.
job of the doctor to be that counselor, right? Your job is to treat. And I
Yeah.
wish hospitals or yeah, they had more people to do that. Counseling is a completely different skill here. Like I'm not a counselor. I can't counsel people. You have to listen a lot. You have to reframe questions. So it's a different skill. It's yeah. At the end of the day, of course, the doctor must have some basics of that, but you should hopefully have somebody who can be that person and
Yeah.
invest in that resource.
Yeah. Makes a lot of sense. Perfect. On the clock, Ravi. Thank you so much
Thank you so much.
for doing this. And we look forward to having your feedback on what more topics can we do in this series of practice essentials. So please do write to us at support@medflix.app. Let us know what topics, or if you have any speakers in mind, please do refer. Thank you so much, and have a good night. Good night, Ravi. Thank you so
Thank you,
much.
everyone. Thank you, Rohan. Thanks. Bye.